Tattoo artists must be fully aware of the potential dangers of their procedures and how to prevent infection. Tattoo artists and body piercers must follow health and safety practices and clean technique to protect themselves as well as their clients from bloodborne pathogens and communicable diseases that include viruses, bacteria, and fungi. A tattoo is done by injecting ink into the dermis, the inner layer of the skin, with a needle attached to a handheld tool where the needle is vibrated up and down at a rate of several hundred times per minute. Infection can be spread through unsterilized equipment, contaminated ink, not handling needles correctly, and improper cleaning of surfaces and the client's skin prior to the procedure. Bacteria, viruses, and fungi can be present on the skin of the person receiving the tattoo or the piercing. The tattoo or piercing needle that comes in contact with that skin where the germs are on the skin can then contaminate the needle or ink and then become a source of infection. It's so important for a body art professional to use aseptic technique for tattoos and body art. Aseptic technique is used to prevent cross-contamination. In other words, it prevents the transmission of germs from one person to another or from one place to another. Visible blood on surfaces, instruments, or needles is not necessary for infection to be transmitted. When working with a client, all surfaces and used equipment needs to be considered contaminated. The goal of using aseptic technique is to protect the body art professional and the client. Aseptic technique includes the following principles. The body art professional needs to cover his or her own skin that may have wounds, infections, or dermatitis. Also, clothing needs to be clean. Don't let used equipment come in contact with clean or sterile equipment. Maintain the cleanliness of all supplies by storing them in a sanitary manner that protects all items from contamination. Make sure that the disinfectants are properly stored and that chemicals are properly labeled. Use barriers like single-use gloves and gowns. Use proper hand hygiene. And when wearing gloves that potentially have body fluids on them, don't touch other items. Remove the contaminated gloves properly before answering your phones, adjusting light fixtures, or picking up clean ink bottles or getting supplies out of the storage. Now, before you're giving tattoos or piercings, properly clean and prepare the client's skin with a skin antiseptic. Ink shall be from a single-use container and only used on one client. Ink that's stored in bulk containers can be transferred to a single-use container though. Now dispose of single-use containers after each person. Never mix inks with tap water. Only use distilled or sterile water. Use disposable single-use needles and follow safe injection practices. Immediately dispose of those contaminated needles, dressings, and disposable gloves, etc. Maintain a clean and sanitary environment by using a proper disinfectant. Disinfect your chairs and work surfaces between each client. Reusable tools and equipment must be cleaned and sterilized. Sterilization machines, such as autoclaves, must be regularly tested and serviced. Needles or other sharps that have contacted skin or body fluids shall be placed in a puncture-resistant closed container, otherwise known as a sharps container. There's normally a line at the top of the sharps container that will let you know it needs to be disposed of properly. Now remember, these are general guidelines to help protect you and your clients. Each workplace must have a written exposure control plan that outlines the proper procedures that are specific to your facility in regards to the proper disposal of regulated waste. Use of engineering and work practice controls and the proper use of personal protective equipment all must be customized to your workplace.